All right, so have you ever thought about where would we be at today without the Affordable Care Act, or better known but from a popular standpoint, Obamacare? Like, where would we be at in the year 2024 if that didn't go down? And this is a question that I find myself having to ask quite often, very recently, especially as election season's coming up, especially as Supreme Court continues to hear cases that threaten to challenge it, or more importantly, parts of it to make the whole thing unconstitutional. And I give this flashback because I don't think a lot of people really remember just how bad it was, just some of the things that was going down prior to the Affordable Care Act. And depending on the state, and I know this is state dependent, and that's something that we'll definitely bring up during today's episode, that it is state dependent on how good or quote unquote bad it is. But I think whether you are in healthcare, everyone's in healthcare. Either you're working in healthcare or you're being worked by healthcare, like one way or the other. Like you're being taken care of or you're doing the taking care of. So I wanted to say that and make sure I stress, especially we just coming off this amazing episode, Think Like a Doctor, understanding that if you really want to take care of your health to the best of its ability, you have to be aware of all of the things that can affect you yesterday, today, and more importantly, tomorrow. So we're going to talk about the Affordable Care Act. Again, we won't deep dive because I know you guys don't come here for the full deep dive. But I want to give some kind of overview just so as we, listen to these debates and as we get ready to, get into election season and vote for our congressmen and, our House representatives and our president, like understand what's at stake here. Before I start, I want to give a personal story, right? Of just what was life like before Affordable Care Act. We had over 50 million people in this country uninsured. 50 million people walking around with no insurance, with one medical accident that could change their whole trajectory of their life. 50 million people walking around uninsured. And you had insurance companies that made it their business to say, you know what? I'm not going to approve you for insurance. I'm not going to accept you on our plan. But I remember I had insurance with the company I was working at, and I ended up leaving that company to go work for someone else. And so here I go thinking, oh, okay, I was just insured by you guys. And, I'm going to be leaving another job. Let me just see what it would be like to go and get insurance, directly instead of having to go through my employer. Only to find out that that same insurance company denied me because I had a pre-existing condition. And you might be saying, Dr. Pierre, what is a pre-existing condition? Right? Yeah, these are terms that you probably didn't have to think about before, especially to the detriment of yourself. So whether you were anemic, whether you had high blood pressure, high cholesterol, whether you had a fall and broke a bone, you were considered to have a pre-existing condition, aka a diagnosis. We talk about this all the time as far as learning what your medical history is. So insurance companies was using your medical history to say, you know what? I'm not going to approve you for any insurance. And again, this was the same insurance company, right? Like, again, forget it, Blue Cross, right? I'm going to call you out because I thought it was crazy then and it's still crazy now. That Blue Cross Blue Shield, when I was under my employer, essentially had to accept me. But once I stopped working with that employer, they then turn around and use the same diagnosis, the same medical history that you already knew and say, you know what? We're going to use that history against you and say, you know what? We're not going to give you any health insurance. This was a common thing amongst all the insurance companies. Like insurance companies were looking for reasons to drop you to the point where if they had an opportunity to drop you and they did, the likelihood that they were going to take you back was close to zero. You had patients who were pregnant, change insurance and say, hey, you were anemic when you were pregnant with your last baby. I'm not going to approve you for any health insurance, at least with our company. The same company, right? So this was the setting. I almost call it like the wild, wild west of what was occurring prior to the Affordable Care Act and prior to President Obama saying, you know what, something has got to change. And here we have with the Affordable Care Act. So let's talk a little bit about, some history with Affordable Care Act. It was passed in 2010 by President Obama during his administration. And it did a few things that were monumental to this day. Again, 14 years later, monumental to this day in protecting us, the patient. So first and foremost, it expanded coverage. It said, hey, you know what? We need to not have 50 million people walking around here without insurance. That is detrimental to us as a country. That 50 million people could walk around here, and if they stub their toe or they get in an accident or something happens, their whole life is ruined. because they didn't have any coverage to cover mountains of bills that were going to come from the doctor, the hospital, and everything else. So I said, you know what? We need to expand who can get insurance. And this was expanded across countries, expanded even lower income tier people in our country. Say, hey, we are going to give you an opportunity to get on this insurance. In fact, we are going to create a space that you can actually say, hey, you know what? These are, my family members, this is my medical history. And then I'm going to let you choose from the insurance that are available. And there's always insurance that are available to choose from, right? This was not the case before, right? Prior to the Affordable Care Act, I couldn't just go online and say, all right, I got 2 kids, a wife, no medical history. All right, give me the plans. Like I couldn't do that because I would go to one insurance company, they would deny me. Second insurance company would deny me. And it'd become this denial train that all of these insurance companies would just deny you left and right. Now you had a marketplace that says, hey, you know what? We are going to cover you if you're looking for insurance. And we're going to expand who can get insurance. We're going to make it more affordable for those to get insurance. And most importantly, we are going to protect the patient, which sounds wild that you would have to have laws to protect the patient. But you had these insurance companies, the Blue Crosses, the Aetnas, the Uniteds of the world, making billions of dollars every quarter, not a year, every quarter, making billions of dollars in profit a quarter just to be able to deny and only take the healthiest patients who were going to use the system less and then still collect all of their premiums, right? Like it's an amazing racket when you think about what they had beforehand, which is why a lot of them were staunch opponents of the Affordable Care Act, right? Think about it, right? If I stand to now have to accept more and more people who may be more sicker, who haven't had coverage in years, which means that they're going to use the system more, which means we're going to make less money. So these companies were staunch opponents of the Affordable Care Act, right? And you can kind of figure out, right? And I tell my healthcare colleagues all the time, right? And because sometimes my colleagues will be like, oh, I'm not really into politics. I'm just here to practice medicine. If you are in the practice of medicine, you are in the practice of politics. Because what the politicians can do, will do, have done, affects your activities of daily living, affects your livelihood every single day. So yes, you are in politics, whether you want to be in denial of not, you are in politics. So you had this aspect of insurance coverage being expanded. You had this aspect of patients being protected, meaning that you can't deny me because I had pre-existing conditions. Blue Cross, you can't do that anymore. And we had this aspect of just making it more affordable for our patients. Yeah, we're not necessarily getting in the nitty-gritty because, there's medications that were covered, preventative health service that were covered, your wellness checkups, your screening mammograms, your screening colonoscopies. All of a sudden, they were being covered and you, the patient, didn't have to pay for it because it just made sense. And I've talked about this all the time. If I prevent the disease or I prevent the progression of said disease, it's going to save everyone money in the long run. But these insurance companies didn't look at that. They were saying, hey, you know what? We'll just take care of it when we had to take care of it. But they knew they didn't have to take care of the sickly patients. But now that they were getting patients who had more comorbidities, hypertension, diabetes, cholesterol, whatever, all of a sudden they knew they were going to have to spend so much money. So now all of a sudden they're like, all right, you know what? Like, thank you for, encouraging our patients to do their wellness checkups every year and cover a mammogram and cover that colonoscopy, because if we can save them, from their blood pressure being uncontrolled and them needing, to see a kidney doctor because the kidneys are failed, if we can save them from being in the hospital because they had a stroke, if we can save them, right, from having cancer and paying for all the cancer drugs, yeah, we'll go for that, right? So it was one of these things where the opponents all of a sudden were like, okay, that makes sense. And then they started looking at it like, hey, you know what? Our pool just got a lot bigger, right? Again, you had about 50 million people who didn't have insurance, and that number drastically declined. So guess what? Now you have a drastic number of people who were paying into the insurance pool that weren't paying before because, one, the insurance companies wouldn't allow them to pay and they couldn't afford to do it. So it was one of those things where they were opponent against it, fighting it. But once it came there, they were like, okay, all right, we'll make some money. And that's what these companies will do. They're always going to find a way to make money on both ends of the stick, right? So you had these provisions that said, hey, thank you right, for now having, the Affordable Care Act, aka Obamacare, because all of these positive benefits that we're doing. Like, I used to have patients who hadn't seen a doctor in years, but now because they had the Affordable Care Act, they can see a doctor, right? They can get their high blood pressure taken care of. They can get their high cholesterol, their diabetes in check. They can get that screening mammogram. They can get that screening colonoscopy. They can make sure that prostate cancer isn't going to kill them. They could do these things. And more importantly, if they had some of these courses, now guess what? Now they can actually see the doctor that they need to see, right? Because people would actually take their insurance, right? This was a win-win for the consumer, for the patient, for the businesses, and everything else. But again, it's one of those things where when you think about it, it's just commonplace now, but it was not commonplace back then. And I always stress that because I think a lot of people, especially when you hear these politicians and Supreme Court justices, always are trying to figure out ways to like make it quote unquote unconstitutional, right? They're asking for a time to go back where your Blue Crosses, you United of the world can say, you know what? I'm not going to take your insurance. I'm not going to put you on our insurance plan because you're sick or you have a history of being sick and you may cost us money. They want us to go back to that. And trust me, this is a thing that unfortunately, the politicians, especially on the Republican side, have been finding ways to try to fight it, tooth and nail, make it unconstitutional. Because again, big business at the end of the day is like, hey, you know what? Like, we've made all our money, but we want to fight this because we don't want everyone to be insured. We don't want everyone to have access. And that's unfortunate, but that's why as a healthcare provider, you can't be like, I'm not into politics or I stay away from politics. No, if you're taking care of patients, you have to be aware of everything going around us, especially from a political standpoint. So let's talk about the impact of the Affordable Care Act and what has it done in these past, almost 14 years since its passing. And uninsured rate has dropped significantly. We've had our preventative diseases, whether it be hypertension, high cholesterol, diabetes. We've had mammograms, colonoscopies. All of these rates of actually preventative measures increase. If you're in the primary care field, we've had funding increase for the primary care field, right? Because it's recognizing and they see the numbers. They see what the numbers are showing. The numbers have shown, hey, if we address and focus on these preventative measures, we actually end up saving money. And again, I wish I could say this is common sense, but in medicine, especially from a business perspective, I see that a lot of people don't typically operate with common sense. So to me, as a physician, when the Affordable Care Act came around, I was a third year medical student. Fourth year medical student. And I could see almost overnight for me, right? Overnight as a medical student and then a soon-to-be resident, overnight, the new infusion of patients who are like, all right, I finally was able to get insurance. And I was finally able to take care of myself. I'm just hitting the circuit. Like, I got to go to this doctor and then I got to go see this doctor. I've been wanting to do this, but I couldn't do it. I couldn't afford to do it. The doctors wouldn't take my insurance. I've been wanting to do these things, but I could not do it. So you saw from a patient perspective, we talk about thinking like a doctor. We're talking about empower yourself for better health. We saw from a patient perspective, more and more people becoming empowered with their health because now they knew they had access. I'd scream this from the rooftop that a lot of times, a lot of our disparities in healthcare, in medicine, deal with the fact that access is not equal. And at the time where you had insurance companies, the people who were supposed to protect us and take care of it, you had insurance companies actively lobbying to make it so that the sick people stay over there and not get coverage and, only accept the healthy patients. When you had insurance companies actively lobbying against what the Affordable Care Act plan was going to do, you can see how much relief they've gotten since being able to come out here and say, all right, yep, I have insurance now, right? It's a blessing, right? And it's one of those things where because I did outpatient medicine, then I did hospital medicine, and you could just see more and more points of contact within the healthcare system happening since 2010. Before 2010, I'm avoiding doctors. I'm not seeing doctors. After 2010, after insurances were available, after plans were being given to people who actually needed it, guess what, right? More mammograms, more colonoscopies, more wellness checks, more people getting control of their blood pressure, their blood sugar, less people dying. I know the insurance companies don't like to hear that, right? But less people died. And again, I just sometimes shake my head when I hear and I see these news outlets kind of talk about the evilness of the Affordable Care Act plan, because it just just tells me, one, they're not in the healthcare system, or more importantly, two, they're on the side where they can afford to go to a doctor privately, or they can afford to pay for the medical bills, and they don't care, nor do they not have the empathy to take care of those who cannot. And I didn't become a physician because I just wanted to make sure me and my family were taken care of. No, I became a physician because I wanted to make sure everyone who needed to be taken care of could get taken care of. That access and the obstacle to get access was knocked down at every way, right? This is why we do this thing, what we do here online. Whether you're watching the YouTube video or you're listening to my podcast, make sure you subscribe to both. Whether you're doing that is so I can make it so that, hey, you know what? I may not be able to get to my doctor, and maybe my doctor don't have time to kind of talk to me about the Affordable Care Act, but like I just listened to Dr. Pierre, and he kind of gave a nice little overview of why I should care about it, so I'm back caring about it. So when I hear a politician on TV saying like, oh, we got to get rid of this, what do you mean? And go back to the old way, right? Because that's what it is, right? When they want to get rid of it, there's usually no alternatives. They don't really mention what the alternative is. The alternative of having your services covered, your medications covered, like they don't actually ever mention what the alternative would be if they get rid of it. They just want to get rid of it. And that is scary because we know that the Affordable Care Act has saved millions of lives here in this country. And to hear people say they just want to get rid of the program with no actual, piece of legislation to say this is what we're going to replace it with because we think this option is better, you should run away from that. Again, it's just me. All right. So as we continue to see the benefits, feel the benefits, absorb the benefits, as we continue to see the benefits of what the Affordable Care Act plan or Obamacare, whatever you want to call it, as we continue to see those benefits, here in the year 2024, we have to really start asking ourselves and really start asking the questions. Again, you don't come to this channel because you just want to be told stuff and then, sleep with it. No, you want to get what you get from this channel here and then run with it and make your own educated discussions, right? You got to ask yourself, right? The next time you hear someone say they want to get rid of Obamacare, okay, and what do you do about the insurance companies that used to be able to deny me because I had high blood pressure? Because I can assure you that if that plan got repealed today, the same insurance company that you are on right now is praying that you miss a payment. They are praying that you miss a payment so they can drop you and then say, oh, I'm sorry, we can't take you anymore. You have a pre-existing condition. Even when you're like, but yeah, I have a pre-existing condition because I was on your plan. They say, yeah, I'm sorry. It is what it is, right? These companies are praying and hoping for that. So we have to, again, I know election season is coming. We have to put it on Front Street, right? We have to call to question anyone who is willing to say, get rid of it, replace it with what? And more importantly, how do you prevent us from going backwards? We've had 14 years of an amazing program. And can it be better? Sure. But I can assure you, and again, like I said, we don't need to go through a whole civics lessons, but I can assure you that if you're in certain states, the Affordable Care Act plan is amazing and life-saving and saves a lot of money. If you're in other states, if you may not feel as much benefits from it, but it's not because of the Affordable Care Act. It's because I'm in Florida, you likely have a governor and a legislator that is unwilling, think about it, unwilling to say, hey, you know what? They're giving us these benefits. Let's take advantage of them. I'll talk about Florida. You have Florida who will not expand coverage, who will not allow more insurance companies to be in this state. If you're in Florida and you're looking up insurance companies, you'll see that, you know what? The list of options I have isn't as vast as if I was in a different state, right? That's a statewide issue. This is how politics tends to play games on my patience, right? They play these political games and make it seem like, no, the Affordable Care Act plan is terrible, right? Purposely don't enact regulations and programs that would benefit people in your state. Like they do this on purpose just so they can point and say, oh yeah, I told you that program wasn't good, right? I told you it was bad. I told you you have to get rid of it. Like I said, we are not here for a full-blown deep dive on the Affordable Care Act plan. I'm here as a physician letting you know that the Affordable Care Act plan saves lives tenfold. And any talk of anyone want to make it unconstitutional, repeal it without saying, hey, I'm going to repeal it, but I'm going to make it so much better because I'm going to add this, this, and that. Like you should call out on Front Street immediately. Call me out on Front Street, right? Get in the comments saying, hey, Dr. Pierre, I don't believe you. I don't think the Affordable Care Act plan is that great, right? So we can have a discussion. Now, I'd love to have it, right? But it's one of these things where like we can't, as a healthcare provider and with someone who is championing others to take care of themselves, empower themselves for better health. As a person who does that, I can't keep screaming from the rooftop these things and then allowing people to say the Affordable Care Act plan is like Satan and we should get rid of it, right? Not on my watch, right? So again, yours truly, Dr. Pierre, stay tuned next week. We're going to be talking about some preventative service initiatives that you need to take advantage of, especially while we still got the Affordable Care Act. I don't think it's going away, hopefully, but like we need to take advantage of some of these preventative health services that are available to help us think like a doctor, more importantly, to help us empower ourselves for better health.